Something that's really important for managing anxiety in patients, or that I like to talk about with patients, is a multifactorial approach to treating anxiety and mental health. And that's something we don't always get from other providers. We either seem to find some holistic providers that just prescribe herbs or just want to talk about changing your attitude, and then some other providers that only want to talk about prescribing medication, probably even more commonly the latter. And what that is missing, unfortunately, is the reality of how anxiety manifests in a real human, which is that it's all of those things all together. There's a time and place where we need to use medications, and there's a lot of other things that need to happen and be corrected in the body. So anxiety, fear, PTSD, depression, a lot of those, what we consider to be negative mental health aspects, live in a part of the brain called the amygdala. And the amygdala is this kind of primal part of the brain that's present in all animals. So most exaggerated way, or maybe obvious way to talk about that, is thinking about the fear that you might see in a deer, right? So a deer is going to know instinctually and very, very quickly when there's a hunter around. And that deer is going to know very quickly to run. A whole cascade of things happen in the body when that occurs. Blood vessels dilate, so we get more, blood to our skeletal muscles. Our pupils dilate so we can see the surroundings around us. And that reaction in the deer seems so obvious because they have to survive, right? They need to be able to run very quickly away from the bear. But essentially that same cascade of things is what's occurring in us when we experience anxiety. So that amygdala, that primal part of the brain, is being activated, and it happens very quickly, which is why anxiety often feels like something that we can't control. So an approach that I take, and that I think is incredibly important to take, is how we can shift how our brains view that lack of control or that immediate response. And one thing that's really helpful with that, in addition to, a big part of what we do here at Protea, which is hormone replacement therapy, is something called mindfulness, which is working on changing actually physically the structure of the brain, but also how our brain, the parts of our brains are communicating to each other. So opposite of what animals have is we also have this part of our brain called the prefrontal cortex. And the deer doesn't have that. The bear actually also doesn't have that. But we do, and that's that logical, conscious, risk assessment, decision-making part of the brain. So when anxiety is really active, we become a little bit more like the deer. We're not thinking clearly. We're not actually making any choices about where we run, right? We're just, some instinctual part of our brain knows that there's a threat and we need to run away. So what we can do with the help of course, medications and, of course, hormone replacement and all these other things is to work on activating that other part of our brain, the prefrontal cortex, where we do get to make a choice. And there's a lot of ways that we can do that. Therapy is amazing. We talk about therapy all the time here. We refer probably every day to different kinds of therapists to help our patients through these things. I think we, in a way, act a little bit like therapists ourselves in counseling our patients. So that's really great. Mindfulness practice is really important. And that's, anywhere from self-care to a formal meditation practice. Those things can affect that part of the brain. And what we're going for with all of the different treatments we're doing is this, utilizing medication to maybe give us a solid foundation for where to start, utilizing therapy to work through whatever's triggering the anxiety in the first place, and then using this mindfulness to kind of strengthen and grow the other part of the brain that's going to give us that long-lasting resolution from the anxiety. So if you're struggling with anxiety or looking for another approach to treating your anxiety in a little more whole person perspective, we've got more videos you can watch. Feel free to make an appointment. We'd love to see you and help however we can.